Good morning and welcome everyone. Council is convened for our work sessions. This morning we have Public Health and Community Service, and starting us off is Dr. Melnick with Public Health. So welcome, and please feel free to get started.
This is an intelligence test for me, I think. For the record, Dr. Alan Melnick, I'm the Public Health Director as well as the Health Officer. So I'm going to go through a really brief overview of our department and services. And I think next month we'll be having our first, with the new counselors, a new Board of Health meeting. So get into more detail then. But go to the first slide, please. Just this overview is I'm going to briefly talk about our structure and our programs. You'll see an organizational chart. And then I'm going to talk about our funding, where we get our funds from. And then there's several different fund sources. One is our public health fund. The funds are our public health programs, then our solid waste program, specifically for solid waste, and the medical examiner's office. And then I'll talk briefly about some policy ways that you're involved in policy. And there'll be more discussion about that, I think, next month as well. So if we go, so here's the org chart. I don't know how well you can see it, but, and we'll go into this next month more, but in our situation, the Clark County Council also serves as a Board of Health. There's different structures elsewhere in the state we'll talk about more next month. And then if you, okay.
And if I could just interject really quick, I just want to let council know this was in your packets that you got in your binder and your thumb drive. So, and just as a quick reminder before Dr. Melnick continues, is that all the departments are going to be coming to provide a 10 to 15 minute overview of their operations, of what they do, major funding policy areas. You guys can still engage in questions and answers beyond that 10 to 15 minutes, just wanting to make sure we're being succinct, knowing that we also provided some information ahead of time. And this is setting the foundation for future policy direction in general, as well as anything that might be tied to our general fund for budgeting purposes.
Thanks for that context.
Moving to the little bit of the side of the organizational chart there, you can see we have a Public Health Advisory Council, and this is an advisory council to the Board of Health, and we'll talk more about the Public Health Advisory Council, and we talk more about the Board of Health next month in February. And then moving down, well, you see where I'm located there. Off to the side there, we have a deputy director position that's currently vacant. Our previous deputy director left on January 9th, so we're in the middle of recruiting, and that should be filled hopefully pretty soon. And then we have a deputy health officer as well as a physician who, like me, is not only licensed as a physician but has a master's in public health. Is Dr. Brianna Da Silva Batia. She just started this month, and we provide health officer services or contract not only through Clark County, but to Skamania, Wahkiakum, and Pacific counties as well. And we'll talk more about the health officer role, including the statutes associated with that next month. We have 4 divisions. One, if you move from the left to the right there, one is our community health division, which includes programs like health assessment and evaluation. That includes our epidemiologists who do data analysis. For example, they analyze the Healthy Youth Survey data. Through the year, as we give different presentations to you about what we're working on, we'll get into more detail on those. We have our Life Course program, which includes work we do with pregnant and parenting families, including children with special health care needs, chronic disease prevention, access to care, infant and child oral health. We have the Nurse Family Partnership Program, which is an intensive home visiting program for pregnant women and follows their their child until the child is 2 years of age, so follows them as an intensive case management program. And then also within healthy communities, we have, in community health, we have the medical examiner's office. So then moving to the, a little bit to the right there is an investigation and response division. So that's where we do infection prevention. For example, we work with long-term care facilities in terms of their infection prevention policies. We do sexually transmitted infection and HIV prevention. That includes case investigation and contact tracing, and in terms of preventing spread of HIV as well as sexually transmitted infections. And all other communicable diseases are in there also. So that's a division that, for example, responded to the COVID-19 pandemic. And there's a whole list of notifiable conditions and communicable disease conditions that we will share with you over time. In moving a little bit more to the right is our Administrative Services Division. And that includes, we have our FEPR program, a Public Health Emergency Preparedness and Response program there. Vital Records, which is birth and death records. Our finance team is there, and as well as our grants and contracts team. And we also have a robust or developing a robust performance management and quality improvement program. And then off to the right is our environmental public health program. And that includes programs like food safety. For example, our food inspections are there. On-site septic and drinking water, operation and maintenance, recreational water safety. That includes not only swim beaches, but we also inspect pools and spas as well. And then solid waste operations and outreach are in there as well. Okay. So now we're going to get into the next slide, please. The Public Health Fund. And if we can go to slide 5. Next slide. Okay, so we currently, so this is Fund 1025. We currently have about a little, almost 150, a little bit over 156 full-time equivalent staff. We have 36 distinct program areas, so I'm not going to get into a discussion about all the programs. And the budget for this is about $23 million a year, a little bit over. I'm also going to describe foundational public health services. There's a we over the last several years, we've got increased funding from the state for what's defined as foundational public health services. And just briefly, these are core public health services that protect and improve community health. And they're primarily or either primarily or only provided by the governmental public health system. So that's how they're defined in the state, and we'll talk a little bit more about them. And then the concept of mandated services, and there's overlap between foundational public health services and mandated services. So mandated services are required by RCW and WAC, Statute Administrative Code, and examples of mandated services are things like communicable disease control, food safety, septic, all that stuff is mandated by law and code. And again, there's overlap. Not all FPHS is mandated. So some foundational public health services are not mandated, but we're funded by the state to provide those services. So let's go to the by the way, virtually most of our mandated services are also foundational. Okay, next slide, please. So in terms of, I'm going to go a little bit more detail here. I've already mentioned this, examples of mandated services that are also foundational public health services are food safety, on-site septic, permitting, operations and maintenance, prevention of sexually transmitted infections, and that means responding to them, case investigation, contact tracing, ensuring that partners get treated, people are exposed to get treated, and the same thing for other communicable disease. Those are all mandated. In those areas, we have almost 73 FTE, and about $13.6 million out of our in our budget. Okay, next, and here's just a graphic of that. You can see that most of the funding is charges for services, specifically fees like restaurant inspection fees or septic permitting fees. There's also state funding, it's FPHS, some federal funding, and a small, FPHS doesn't cover everything. Fees don't completely cover everything. So there's some county general fund in there, as well as some grant funding as well. And Jeff Harbison, who's our administrative services manager, is on if you have specific questions that he can help answer around those. But it would be great if FPHS paid for everything, but it doesn't. So there is some county general fund. And again, these are mandated services as well. We're required to provide them. Next slide, please. Then I'm going to give you some example of non-mandated services. These are core services that protect and improve the health of a community, but not required by state statute or administrative code. So our emergency preparedness and response program, that's not mandated, but it's a very necessary and to improve the health. So we've actually gone into incident command, trained. We've got teams responding to COVID-19 pandemic. We had a measles outbreak, larger measles outbreak. We had to use our skills and training that this program provided to respond. We've had a number of those over the years. That's FPHS, but not mandated. Our health assessment and evaluation program is essential where, the data, the community data that we provide, our community health assessment, community health improvement plan is that's one of the services that program provides. And then we've certainly been involved in areas around life course, including things like access to care. We had concerns, for example, about access to prenatal care here. So our team works on those issues. Total staffing for that is $5.9 million a year, and we've got about a little bit under 33 staff in that in those areas. And the next slide will show the breakdown. So most of this, because it's FPHS funding from the state, and most of the funding is state funding. There is some federal dollars that go in there. Some charges, it's a pretty small amount of fees. And again, the FPHS funding is not enough to do this work. So there's county general fund in there, as well as we also get some grant dollars. Okay. Next slide, please. Okay. And then in the state FPHS definition, there's also, they're foundational public health services, but they're called capabilities. We can't do all these other things if we don't have the infrastructure to do this. So it's necessary infrastructure to support the other FPHS services. So that includes environmental public health support. So that's our staff who actually, when you come to our building, our office, that's where you get your permits, for example. So support staff do that. So for example, permits for food establishments or on-site septic systems, that support provides that. Our finance, grants, and contracts team, we have a number of contracts do this work. We need to have, those kinds of capabilities. And communications is a foundational public health capability. So, for example, when we put out provider advisories, when there's, and you'll see some of those, when there's a public health issue that we want physicians and other healthcare providers in the community to be aware about, we'll put out provider advisories. I think, like recently, I think we put one out around whooping cough and pertussis when the numbers got really high. And we want physicians to be aware and provider community to be aware. We also do Also foundational capabilities, performance management and quality improvement. Our staff is a little bit under 40 staff on that and 1.5 million for that. If you want to show the next slide, please, that shows the breakdown. You can see how much of this comes from foundational public health services, only a small amount from local grant. There is no county general fund in here. Okay, next slide, please.
Can I ask a question?
Sure.
What's the reserve?
Jeff, do you want to, hopefully Jeff can answer that question.
Yeah, sure. We actually went through a footprint reduction effort the last year, and that reserve, that actually recognizes the amount of space, the lease cost of the space that we gave up until we find a new tenant. It came down to, do we budget reserve or do we lay 2 more people off? And we are in the process with county staff trying to find a tenant for this space.
Okay. Now, so there's another category of services called additional important services. So these are not foundational, by definition, but one really, well, our only example is, I can recall, is our nurse family partnership. So that's that home visiting program for high risk pregnant women and their children. The next, and there's $2 million in that, and I'll do the next slide, please. And there's federal funding for that. That includes the federal funding, includes the maternal child health block grant, as well as Medicaid administrative claiming. I'm not going to get into the details on that, but that's where the federal money comes in. A lot of this funding is from the mental health sales tax. So we applied for mental health sales tax funding. Lots of these families have, or a number of families have substance use issues as well as mental health issues. That's why they're higher risk in terms of those situations. There's higher risk of interpersonal violence, domestic violence in these families, as well as being able to provide this case management support. These families can actually reduce early childhood trauma, which we're trying to prevent, and early childhood preventing that. We know that early childhood trauma leads to increased risk as those children grow up for mental health as well as substance use issues. So it's a prevention program in terms of mental health as well. And that's why it's funded through the mental health sales tax. Okay. I think that's all for the public health fund. And next slide, please. So the solid waste fund, and that's all. Next slide, please. Our work at solid waste is all mandated. That's for the required refuse and recycle services provided within Clark County. And that's a staff of almost 16 FTE and $3.9 million. Next slide, please. And that's funded by, basically funded mostly by fees. Okay. Or charges for services. Well, yeah. Next up is the medical examiner's office. And that's also mandated. We're required to provide those services. This is the medical examiners investigates the death of individuals in Clark County over which the office has jurisdiction. So it's, traumatic deaths, unexplained unnatural deaths, things like suicide, homicide, for example. Those are investigated by the medical examiner's office. And they're required, and we have 15 staff there with a budget of 2.4 million. And the funding, most of that comes out of county general fund. We do charge some services like for the functions of that the office does to help with, we call it disposition authorization, where in terms of the decedents. And there's a charge for that service, which helps a bit. That's it for our funding. I just wanted to talk about policies for a bit. So our budget really reflects policy. So you have, as the Board of Health approves our environmental public health fees. So that's part of the authority the Board of Health has, and that is a policy to provide those fees is a policy decision. And then in terms of our operating budget, the Clark County Council approves the operating budget. But there are other things that you're involved with policy as well. Just to give you an example, a few years ago, the Board of Health approved a resolution declaring racism as a public health crisis. So that was a policy decision the Board of Health made. And also the advocacy work around foundational public health services is, policy that you all can be involved in. So, and I work closely, if there's legislative issues, I work closely with our senior county policy analyst and county manager to bring things to you if we're advocating, if we're going to be advocating for certain policies there as well. So that's, I don't know whether I kept it within 15 minutes or not. Did I go over time?
You did a great job.
Okay.
Are there any questions of council? Go ahead.
Great, thank you. I was curious, so thank you for it was very informative. So the 1.5 million, I heard this term, I think for the first time from you, Dr. Melnick, and it was for the greater good, right? 1.5 million. What I'm wondering is with our current significant deficit that we're experiencing and the budgeting issues that we're going to be facing this year, is there any way to reduce that? And it's a touchy subject because the last thing you want to do is hunting people down for money when they've just experienced loss. But I know also that not every situation is created equal. Some have availability of resources and such. So I'm wondering, is there any way that we can look to reduce that gap to relieve some of the strain on the general fund?
So Councilor Young, which program or?
That is for the last one we were talking about, the
Medical examiner's
yes, thank you.
office?
Yes.
Is there any way, so the funeral homes pay the disposition authorization fee?
Okay, so what I'm asking though is that currently yes, thank you for the slide. So the 1.5 million is in funding is coming from the county general fund.
Yes.
What exactly are those going to that cannot be recovered in one way or another?
So I think actually it's 2.4 million, I believe. Oh, in terms of what part of that? Oh, I should have looked at my graph there. So that basically, until, was it in the past year, we didn't really charge a disposition authorization fee before now. We just, but basically it goes to the work that the forensic pathologists do. So all their work in terms of doing the autopsies, the staff, the autopsy techs who we have to support that, and the death investigators who go out to the scene, depending on what the situation is, and gather data.
Yeah,
I mean, that all goes to that.
yeah, I understand what it's used for. What I'm asking is there a mechanism whereby we can recover those expenses?
That's a really good question, because certainly the people in the decedents or the families involved, given that these are unexplained and unexpected deaths, that would be an interesting conversation to have, but I'm wondering where we'd be able to recoup that from.
Yeah, I don't know whether we could or not. I don't know whether it's appropriate or not, but I certainly would appreciate looking into that. When we're looking at all the different strains that we're having on the general fund, I think we have to look at every every bit of subsidy that's going into different programs and see how we can reduce that.
I'm struggling with that given, but I think it's a really good conversation to have. So I'll talk to my team and we'll put that on an agenda.
Great. Thank you.
Yeah. That may be, Kathleen, that may be a council agenda more so than the Board of Health, but,
I would assume so, yes, because the Board of Health doesn't have the ME's office
Right.
underneath that. But most of our departments and offices are looking internally at other funds as well to see if we can offset any of our general fund services as well as what can we charge externally. So hopefully Jeff and Dr. Melnick will look into this in the team and we can come back with some options.
it's a great question and we'll work with you on that.
Chair.
Yes, go ahead.
I just wanted to ask also about money and mandated services. I think Councilor Fuentes and I, when we were on training, we heard that the Washington Association of Counties is lobbying on our behalf for bills that would cover some mandated services. Do we know if any of the public health mandated services there's a bill that might potentially cover some of those general fund expenses that we have?
Council Little, I'm not aware of anything on the agenda, on the legislative agenda or any bills this year, but we're always concerned with the state, mandating things, but not provided, we call them unfunded mandates, but I'm not sure of any bill this session that's addressing that.
Okay.
And given the state budget, so we've been able to put FPHS funding into before we got FPHS funding, and we've got 7 million more a year than we had a few years ago. And we put a lot of that funding into mandated services, where there may actually be, from what I'm hearing in the governor's budget, a cut in, or even Governor Inslee's previous governor had somewhat of a small cut in FPHS, so in Foundational Public Health Services funding. So we're going to continue to advocate for more of that, but I don't see anything unfortunately on the agenda from the state, just from where I sit, that we're going to have more funding for that.
Okay. Thank you.
Any other questions? Go ahead, Counselor.
If there are no other questions, I did have a comment, and I brought this up on many different occasions. I still feel like our efforts to reduce and eliminate the crisis that we're experiencing on our streets and in our homes right now, the opioid crisis, I just don't think it's being given the attention it needs. So, when we talk policy, I would love to see, on the organizational chart, and I know this is going to be a mixture between public health and community services for certain, but is there do we have a lead, somebody that is focused solely on the opioid crisis?
That's within our community health program. So our plan, remember we presented to you last year on opioid morbidity and mortality. And then we presented some of the Healthy Youth Survey data, especially looking at kids, adolescents with substance use issues and risk factors. Our next plan was to bring in our treatment providers and community and have a robust discussion with all of you about what we can all do together. But that work that we're doing in that area would be a lot of that is within our community health program.
Okay.
So we do want to have more of a discussion with you and probably work with community services on that as well.
Yes.
So-
Okay. I would appreciate that as soon as possible, because I see us needing something to the nature of a task force, essentially, and at least one full FTE that's devoted to it, that's looking at all the ins and outs. We know that there are things changing. We're starting to see people that are passing away in permanent supportive housing because they're isolated, little things like that. We need somebody that's working on this, that can work with all the different people involved, with the nonprofits and the providers, to give direction on how we can try to turn the needle a little bit on this and start chipping away at it. Because when we talk about our budget deficit, the opioid crisis we're probably just now starting to feel that. I mean, the strain on law and justice, on every system, you name it. So if we can make a dent in that opioid crisis, that will help us substantially, in our budget situation. It's obviously going to take some time to see that impact, but
Yeah, and that's one of the reasons we have the Nurse Family Partnership Program but that's, 15, 20 years down the road, you're
Right.
going to reap the fruit of that. But that's the conundrum around prevention, because if you want to do, and we'll talk more about primary prevention, one of the most effective things we can do to prevent
mhm.
opioid morbidity and mortality is to reduce early childhood trauma. But you reap the benefits 15 to 20 years down the road, addressing the social determinants of health. Yeah, we need to do that, but the benefits don't occur right away. And then you have to figure out, given the limited budget, where you put your funding. But I
It
think,
is a tricky thing for sure.
yeah,
But
I'd
yes,
really love to have more of that conversation with you. as
looking
Board of
forward
Health.
to it. Thank you.
Thank you, Councillor Young, for raising that question. And I think, seeing issues in the community like opioids, homelessness, shelter, even affordable housing, all are contributors and escalating. So I look forward to that conversation and appreciate the work that you're doing on the prevention side, because it's very hard when there's a continuum of need, all of which is there's not enough resources for where do we strategically put our resources. So it's a difficult issue.
Yeah, yes, Councilor Chair Marshall. And some of this is discussed in our community health assessment, community health improvement plan as well. So we can spend some more time on that as well.
Great. Thank you. Any other questions or comments? Hearing none, I think we're ready to move on. Thank you very much.
Thank you.
Thank you.
Look forward to more discussion.
Good. We do too. Okay, let's move right on to community services, and Vanessa Gaston, welcome. We're ready for your presentation.
Good morning, counselors. I'm Vanessa
Oh, I think
Gaston.